All right, good evening, good evening. We are here once again. Another month has gone by so quickly. Could hardly believe it that this is Health Talk by the Navy's Renal Society in collaboration with Vaughan Radio. And we are here once a month, Thursday evening, the third Thursday of the month from 7:30 to 8 p.m. to bring you actionable information that will help you to maintain your health. And for the Renal Society, our focus is the prevention or the management of chronic kidney diseases. And so we are focusing on the two main medical conditions that will damage your kidneys. And these are diabetes and hypertension, or high blood pressure, or the other word, high sugar in the blood and high blood pressure. And so we want you to understand that you, the patient, every one of us are responsible to a large extent to our health issues, health outcomes. And if we understand how the body works, then we can maintain it and use it much more effectively, efficiently, and prevent problems. I like to use the analogy of you have a motor vehicle which you have invested lots of money in to acquire to take you from A to B and carry your cargo, your load, your friends, and you could enjoy the environment around you. You can cover more distance in less time because you have invested in a vehicle that can perform those functions. And so think of your human body as a vehicle that will take you on your journey through this earthly existence. And so if you want to live long and healthy and well, we have to know how to take care of our human body. And so I make no apologies for stressing these points, that your health care, quality of your health care depends to a large extent on you, the individual. And the duty is on you to get to understand your body and what is affecting it and know how to monitor. We've been stressing that word of the last several programs, monitor. And you cannot have effective, efficient health care if you do not monitor your health status. And monitor comes at different levels. And we are tonight focusing on the individual level. You, the individual, will have to know how to monitor your body's functioning, your body's structure, and how you fit into this world. And anything that causes pain, discomfort, dysfunction, we need to understand those issues and how to manage, mitigate, prevent, alleviate, as the case may be. And we are back again onto diabetes. Diabetes, monitoring diabetes, because it is a metabolic, a lifestyle condition that affects our kidneys. Over 50% of patients who have kidney failure, kidney problems, have diabetes. And if you have diabetes and hypertension together, then the incidence of kidney problems increase to 80% or more. And so we have to understand these two conditions and know how to manage them. And there's enough knowledge, enough science, enough evidence as to what works and what does not work. And the science is getting better and better as we collect more and more data and analyze it. And that's part of monitoring at a macro level as well, at a population level. Data is collected from the number of patients who have a condition, and their medical history profiling is analyzed, and then we could establish patterns of incidences, occurrences of these conditions. And as we analyze the treatment options available, likewise we can see what works under what conditions. And so when we physicians or healthcare providers ask the patient to check with us every 3 to 6 months, or more frequently the case might be, is for a good reason. Because the more data points we have on the curve, we could make better prediction, we could do better management of your condition. And we could spot trends much earlier because we have been keeping a record of your parameters at different points in time and different conditions of day and healthcare, and then we could understand how your body is responding and are not responding to whatever intervention that we may be using. And so these are the simple things that you, the patient, need to understand, that you need to check in with your healthcare provider on a regular basis, and that is one way of monitoring your health status. We are not perfect, but we have enough understanding now of how the body functions, and we can guide you appropriately. And we want you, the patient, to take ownership of your decision. So it is part of my duty and duty of all doctors to educate and empower you, the patients, to understand. And that's why we have these programs, because the more you're aware, then the better you could manage your situation. And if you want to live a long and healthy and productive life without too much morbidity of chronic illnesses, then you need to understand how to monitor your body and what are the parameters to monitor, how often they need to be monitored, and how to interpret what you are seeing, and how to take appropriate action, what resources are available locally and elsewhere that you can access, and how you can access these resources. And well, we can go into all the systemic parameters, issues that relate to proper healthcare system, but that's not our focus tonight. But we just touch on it peripherally, that we need to understand that we are part of a healthcare environment, a healthcare system, and you have to know who are the other actors in your environment who you can be referred to, who you can access to help manage your situation. Now get back to diabetes. Last couple of times we were speaking about every person, whether you're diabetic or not, should have access to a simple device called a glucose meter, or glucometer for short. And this device gives you useful information how your body is handling a load of glucose, a load of carbohydrate in your diet. Because as I said earlier, diabetes is a lifestyle condition, and we love food. Food is part of the culture, and food comes in various forms and so on. So, and nothing wrong with loving food, but one man food is another man poison, if you could use that saying. And so, because of our unique physiology and biochemistry, we may react differently to food. And so we have to know how we as an individual are being impacted by how we are exposed in our environment. The food we eat, the things that we are exposing ourselves to. And some things may not be harmful of themselves, but the systems can become overwhelmed. And any system that is overloaded will break down. And so we have to know how much we can tolerate and how often we can use a product, and then that will help us to understand how we are performing and how we can keep ourselves safe. And so knowing your level of tolerance, your threshold for developing problems, is so important. Knowing portion sizes when you come to food, how much is an appropriate portion size for the moment, all these are important things that you need to monitor. Yes, the food can be very tasty and tempting, and you may want to overindulge. But if it's something that will make your blood sugar spike, increase dramatically, then you'll need to exercise some restraint and control your appetite, control your desires to overindulge. And so having that knowledge of how your body responds to food can be gained by having a glucometer. And I advise my patients to test after eating. You can test before eating, And then you can test half an hour, 1 hour, 1.5 hours, 2 hours, 3 hours, 4 hours. You can experiment on yourself, record the information, and then you could chart how your body responds to the meal you have consumed, how the blood sugar rises and falls after a meal. And that is very useful information. Excuse me. That is one of the way excuse me, that we help to clarify your diabetic status, how much you can tolerate. Excuse me. And there's a test called the glucose tolerance test, where you are given a load of glucose. In some versions, they're given 75 grams of glucose, 100 grams of glucose to drink, syrup, and then before you drink the glucose, you take your blood sugar in a fasting state, and then your blood sugar is tested every half hour for about 2.5 hours after that load of glucose. And that is called a glucose profile, a blood glucose profile. So if you have a glucometer at home, you can do your own blood glucose profile. You drink a malt, a sweetened drink. You know you are diabetic or you're not, but you want to see how your body is responding. Then whatever you consume, whether it be ice cream, cake, it's festival time here, it's independence time in the country, and everybody will be having lots of things to eat and drink the next day or two. And so you could use this time to monitor your body's response to the food you consume over this holiday season. And if you want to be very accurate and exact, then you could monitor for 2.5 hours, every half hour, and chart the rise and fall of your blood sugar after that meal. And then you'll begin to get a better insight. If you don't understand it, no worries. We are here to guide you through the data and help you to interpret what you're seeing. All we ask of you is that you note the time of testing, the time of eating, and then, well, of course, the results of the test will be correlating with the time of testing. And then we could look at the response to the meal. If you could record exactly how much you consume in terms of milligrams, you know, so much better. If you could record the portion size, so much better. And that is all part of monitoring. You monitor the food you eat, the amount you eat, how often you eat, you monitor the response to the food you eat, and then you get good quality data that we can use to analyze your health status, especially when it comes to diabetes. And then with that information, you will know how to use diet as a means of controlling your blood sugar, because you will get to understand certain foods will keep your blood sugar up rapidly and certain foods won't, right? And that brings us to a concept called the glycemic index. I'll mention it here. You can Google it. GLYCEMIC, glycemic index. And we will talk more about it in a subsequent program. But suffice it to say that different foods have different glycemic index. And the glycemic index is the ability of the food to increase the blood sugar after consuming that food. So food with a very high glycemic index of 100%, it goes in percentage or in fractions, 100% will give a rapid increase in your blood sugar. Food with a low glycemic index or index of 0 will not add to your blood sugar. And so you can use that knowledge of the glycemic index to plan your meals. But you have to do some research to know what foods are and their glycemic index. And so this is how you monitor your meals. So get back to the reason why we need to monitor your blood sugar. As I was explaining in a previous program, blood sugar is a sticky molecule. You could tell because when you leave it out on the surface, as it dehydrates, it gets sticky and it sticks on, other things get stick onto it, right? And so blood sugar can react and sticks onto proteins in the body. And the binding of glucose to proteins is called glycosylation. I think I spoke about that before, but you'll excuse me if I keep repeating it because it's a very fundamental concept to understand and to master. because that idea of glycosylation is how glucose does damage to your body. And as I keep telling my patients that high blood sugar will not cause any symptoms for a long time. Your sugar could be running high, sky high, 500, 1,000 sometimes, and you won't feel a thing. Okay? But in the long run, that high blood sugar will have knock-on physiological and biochemical effects which will cause the body to dysfunction. And we will look into these effects of high blood sugar in a subsequent program. If the blood sugar drops below 60, you can't function. So you will know right away. So low blood sugar will not mask itself. And you will know immediately because you'll feel weak, headache, lacking of energy. You can't function, you know. You get jittery and nervous. You may even get confused and go into a coma rapidly from low blood sugar. High blood sugar can also cause the same symptom, but they come on very slowly, very subtly. And so unless you go testing after meals, you won't know how high the blood sugar is going. And that's the danger that I find that most people do not test after meals. Excuse me. So I encourage you, if you have invested in a glucometer, then for goodness sake, learn to use it efficiently and get the best out of it by testing after meals. And then you'll begin to understand how the meal you have consumed is affecting your blood sugar. And then you will, to help it to temper your appetite and your overindulgence in certain foods, and you will get to know what foods to eat and how to eat much more effectively, because you'll be gaining knowledge and experience in monitoring your diet, because you know certain foods will cause the sugar to go from 60 to 600 just like that, you know. And you say, no, that's not too good for me. But if you like that particular food, you could still take some, but you will reduce the amount, and then you will see what is the maximum or minimum amount that you can take that is safe for you. And so that's the monitoring of the glucose and the effect of glucose on your body. As I said, that glucose binds to protein, and if this binding of protein with glucose is what does damage to the body in the long run. And many functional items in the body, the enzymes, the hormones, antibodies, cell membranes, ligaments, tendons, you know, they're all made up of a protein skeleton, protein background, and then other structures, lipids, ions, calcium, different things may be added on to these protein skeleton backbone of most structures in the body. And each chemical the body produces, each substance the body produces, tends to have a protein background, protein skeletal framework. But when glucose binds to these proteins, then those elements, those enzymes, hormones, antibodies, functional proteins, they lose their functionality, because as I said, glucose can cause them to become dysfunctional, and so we have to be aware of that. Membranes begin to leak. And how we know? Because sugar begin to spill into the urine, one, as well as protein. And so when we see protein spilling into the urine, the endothelium, the lining of capillaries, blood vessels, is being damaged, and they're leaking big molecules from the bloodstream into the tissues, the surrounding tissues, or into spaces where they should not be in a certain amount. And so when we see proteins in the urine, we know that the glomerular membrane has become very leaky, and that can happen quite easily in diabetes. And that's one of the ways in which diabetes damages our kidneys, because it causes the capillary membranes in the glomerulus where the filtration takes place to become damaged, become very leaky, and proteins, which are big molecules, now leave the blood circulation and enter the urine tubules. And then these proteins in these urine tubules can coagulate and block up these tubules, and then the kidneys slowly and progressively begins to lose filtration capacity, because the filtering mechanism, the funnel that filters the urine is being damaged by glucose, damaging the membrane for one, and causing proteins to leak. I like to give the example of a sieve, a sifter. If you add acid to your sifter, the acid will damage the mesh of the filter. If you add hot water, if it's a plastic mesh, the heat could also melt the mesh and cause holes to appear in the sieve. And so when you doing your filtering your stuff, whether you making juice, fruit juices, I like to use guava for example, or soursop, then the seeds can get into the filtrate. And that shows that these are big elements which should not be passing through the sieve. And so, because the sieve is now leaky, the same thing happens in our kidneys. When they filter the blood, the glomerulus, which is like the sieve of the kidney, leaks the proteins into the urine, and then we know that the kidney filtering mechanism has been damaged. When we do a simple urine test and we see urine more than a certain amount in the urine, protein more than a certain amount in the urine, we know that the kidneys have been leaking proteins into the urine and the filtering mechanism is being damaged. And we have to look for the cause, and 8 times out of 10 the cause can be diabetes or hypertension, because these two conditions damage the sieve. Hypertension is like you're putting too much pressure on the sieve. So if you're straining your guava puree and you put too much force, you will bust the sieve of your strainer, and so you will force the seeds into the filtrate, into your lovely drink that you're trying to make. And so that's how high pressure damages the kidney. It put pressure and cause the sieve to also get leaky as well, and proteins appear in the urine, and then it damages the filtration mechanism, and so that damage accumulates over time, and we know what the consequences. Your kidneys begin to lose function and they begin to fail. So I will take a little pause, and when I come back I will tell you about an event that is being hosted at NAPAC on the 27th of September. That is 1 week on Saturday between 4 p.m. and 6 p.m. It is being hosted by the St. Kitts Nevis Non-Communicable Disease Alliance. So I will take a pause for station identification, and then we will get back to you and I will tell you more about this event, and we will wrap up our chit chat for tonight.
City, Nevis, this is the powerhouse of the Eastern Caribbean, Vaughn Radio.
And we are back on Health Talk with the Nevis Renal Society in collaboration with Vaughn Radio, and I am your host, Dr. Glenville Liburd, and we have been talking about diabetes and how it can damage your kidney, and you need to monitor what you eat, monitor your blood sugar before meals, after meals, and so on, and monitor your diet, monitor your urine, the protein in the urine. And if you monitor these things and you don't understand, you come to us. That's why we are here, and we can help you to understand what these different parameters mean and how you can interpret the results that you get when you monitor. Whether you monitor with your glucometer or to the lab or wherever you get your information from, we can help you to understand by going through it with you and doing a profiling exercise. And of course, we keep records, so you come to us today, tomorrow, 5 years, 10 years time, and we're still in practice. The record should be there that we can go back and see when the change occurred, when you were normal, and then when the change occurs, and we can help you to understand. But as I was saying before the break, there's an event coming up on the 27th of September at NIPAC, and it's a educational session on chronic non-communicable disease. They'll be screening a video that was produced in Jamaica by the Jamaican Ministry of Health. They have granted us permission to use their video for educational purposes. And the St. Kitts Nevis Non-Communicable Disease Alliance, of which the Real Society is a member, will be putting on this event at NIPAC on the 27th of September as part of the Global Week of Action Against Chronic Non-Communicable Diseases. So the title of the video is called Dying Young: Lifestyle Choices and the NCD Crisis. So it is highlighting the burden of NCDs that is taking over the world, which, as I said earlier, diabetes is part of the chronic non-communicable disease and hypertension. So I encourage everyone hearing my voice to come out to NIPAC on Saturday, 27th of September from 4 p.m. to 6 p.m. at the Nevis Performing Arts Center. That's what NIPACs mean. And it is free, no charge to enter. And it's part of the Global Week for Action on NCDs. It's a global campaign by health authorities to bring awareness and people to take action on combating the scourge of chronic non-communicable diseases. So there'll be a panel discussion after the screening of the video, and I shall be part of the panel along with a dietitian and other health professionals. So do come out on the 27th of September, Saturday afternoon, 4 p.m. to 6 p.m. at the Nevis Performing Arts Center, and be part of the conversation. So with that said, thank you very much for your time and attention, and until next month when we come again, God willing, have a wonderful Independence 42, and be independent with your lifestyle choices and take ownership. That's what independence is all about. Okay, operator, we are out of here. Until next time.
You were just listening to Health Talk, sponsored by the Nevis Renal Society in collaboration with Von Radio.
It is now 8 o'clock.
This time check is brought to you through the